And welcome back, and we're moving into our second conversation for the morning. This one promises to be definitely funny. World Mental Health Day 2018. There's some new things you'll be learning about how they'll be celebrating. As a matter of fact, in to tell us more about it, we've got Juliet Simmons, who is the counselor and mental health unit, and Joyce Ellis, administrator, Welcome Resource Center. Ladies, good morning. It's so nice to have you in.
Morning.
You know,
Thanks for having us.
Yeah.
we're
And
so glad to have
today
you.
is World Mental Health Day.
Wow.
So we know we caught you on a busy day too. You know, it's such a great time to the opportunity for us to round out the conversation about mental health in this country, and I want to start there. Let's talk about how you feel. Just the level of awareness and understanding of the importance of mental health in Belize is at this time.
I believe the awareness, we have done a lot of awareness just by being here, visiting different workplaces, schools, and so forth. So the awareness, we're doing good. I mean, people are talking about mental health now. People are interested now more than they were 10 years ago. So yes, we have done a lot of work in that area.
Yeah.
Creating an awareness. In terms of young people, this year the theme is young people and mental health in a changing world.
Wow.
It's amazing how much more young people are coming in.
Yeah. Yeah.
So they are reaching out for the services. So we just need to be there.
And that's what I was going to ask, because I think, you know, previous generations just saw mental health. There was crazy and not crazy. And then I think the middle ground was understanding, okay, there's something deeper there. While the younger ones are growing up and they clearly know that they have particular things that need to be addressed, whether it's counseling or whatever type of therapy they need. Do we have enough treatment options for young people? So if someone's in standard 6 first form and recognizing signs of anxiety, you know, do they have access to get the help they need?
If you mean if we have enough service providers,
Yeah.
no, we don't.
Yeah.
It's still a field that is not very attractive, I guess, we could say. We don't have enough therapists, we don't have enough counselors or psychiatrists. And young people are in schools, well, most of them, hopefully they are in school.
Yeah.
We don't have enough people there to give that service.
Yeah.
So mostly the high school have counselors. So the primary school, they usually go with their management. Each management would have one counselor, and then maybe about 3 for the government schools.
Yeah.
So definitely no, we don't have enough.
Is it important to have intervention in that early phase? Because I think
Very.
people don't want to imagine that primary schoolers have issues.
They don't want to imagine, they don't want to accept.
Yeah.
And it is, yes, very important that we have intervention from early to
Yeah.
prevent, you know, larger issues later on in life.
Yeah. But let's venture off now into what is mental health and recognizing mental health. The reason being is because we might hear it and then think about it's only
So what
somebody
do we
who is
mean
out
by
there
it?
probably to them not, you know. So what is it?
So all of us have mental health, right? So the question is, how good is your mental health? Good mental health means that you can handle the stressors that life brings, and you could handle it well, and your mental health not affected. That means you don't fall into a depression or anxiety or have anger management issues and lash out at people. Then you have good mental health, because we all experience stress, because life is full of it. So, but it's when we can't handle it, then we see that the mental health problems start to coming in. So yes, it is important that we catch it from early, because a lot of these things, and like we're talking about a changing world. How much has the world changed since we were kids, right?
Yeah. So, you know, I like that. I like that you said that we all will have good days and bad days and sad days and down days. But the difference is whether you're able to kind of regulate it on your own and bounce
snap
back.
into the problem solve mode. For instance, we all need a car. We rely on our vehicles so much these days. So if something major happens to your car, how does that affect you? And maybe you just have one. Most of us only have one. So what do we do? You're affected, your stress level rises. But what do you do? Sulk and worry, or do you snap into your problem solve mode?
Do you go back in your house and crawl into bed and cry?
and I can't come to work or I can't go to school and nothing will work out after this. No, it's
Yeah.
not that. You have to find out how to solve this problem.
Yeah.
Figure out the bus route, figure out, look into the savings that you have to do the repairs and so forth.
Yeah.
We notice that children do everybody throw tantrums. But we notice, like from small again, this is where we tackle problems, that they throw their tantrum, and sometimes parents don't even know how to deal with these things. Is that where we tackle first in terms of dealing with the children and getting them to learn how to manage themselves in doing these things?
Well, like you said, children throw tantrums because they don't know yet how to regulate those emotions. Some emotions are so overwhelming. Anger is one of the big ones. Love is one of the big ones. But love comes out beautifully, right?
Yes.
After hugs and kisses and I love yous and so forth. But anger now on the other end, they don't know how to handle that one.
Yeah.
So that is when the tantrums come. They don't know how to handle disappointments and how to handle a no, you can't have this and things like that. So that is where they're learning how to regulate that and how do we react to that behavior.
That is so true.
Yeah.
Yeah, like if you want to tell a child, I love you, or show me how you love me, so come give me a hug, come give me a kiss. But when they're angry, we don't tell them how to behave, like what's the right thing to do.
Right.
Interesting.
Yep.
Now, I love that focus on young people and what we can talk about, I think, in terms of the range of things that our young people are struggling with. But I also want to bring Joyce into the conversation, because Joyce, the Welcome Resource Center is really a very important haven for people who are adults and have been struggling with mental illness. Talk to us about your role there.
My role is simply just to administrate, and I'll also look for funding to find ways to get people to donate to our cause.
Yeah.
Besides that, I also go beyond my call of duty to connect families and also try and integrate back our participants back into the society by just doing basic skills set with them and see which workplace will be able to take them. And I also try to do the monitoring as much as possible to see if they're on time, if they are well dressed and things like that. I also try to get them their documents because most of them don't have. So an identity is also important for them. Yes, they would come and say, my name is John, and you ask question about John and you need to find that, he is John. So you get their birth papers, and by extension, some of them manage to get their social security cards and things like that.
Yeah.
In terms of mental illness for the population that I serve, people might say, I don't want to go to the center because these people are acting out. No, they're on medication and they are stable.
Yeah.
So have no fear in coming to the center.
Let's build this link, because it's not one that we make very often. So you have the Welcome Resource Center is the drop-in center. It's a day center for people who are essentially homeless. How do you link homelessness with mental health? What is the connection?
It is definitely connected. Think about mental illness and the severe ones, the cases of schizophrenia and bipolar. Those are some of the severe mental illnesses. And then the stigma associated with mental illness and the shame that comes with it. And then people don't want to have anything to do with you because they don't understand. Then there comes a fear. And then people are ostracized from their families and become homeless. They can't hold a job because of these conditions.
Yeah. But
And addiction as well.
And definitely addiction.
Yeah. So why is addiction a mental health issue? I know that's still one of the controversial ones, but
Because addiction is complicated. Just keep that in mind.
I know.
But because again, it's something that affects the brain.
Yeah.
Okay.
So then it can become considered a mental illness.
But
Yeah.
one of the words that stand out for us so far for this morning is actually stigma. And there are a few people who knows for a fact that they're not, they're not able to cope, but don't want to find out that it might be bipolarism or because and we've heard this countless times that that's a first world thing. That's not for us. So in terms of recognizing it, I think the stigma that comes along with it, that is the major pushback for people who wants to seek help. Now, if you want that help, do we have officers who actually go out and seek these people, or listen to stories from home and trying to meet these people? What happens there?
Well, going out, no, we don't really have much of that type of service. So what we expect is that families notice these behaviors that are not normal, that are odd, and come and seek our service and try to get that family member to our clinics to be evaluated, and then we could come up with a diagnosis and start the treatment.
Yeah, what we do at the center, because to the general public we are readily accessible, they would call us, and from out district, from different districts from in the city, and they would say, I have a family member, a neighbor, or a friend who is acting this way, has been for a time, and then the center make that referral. You know what? You need to take them to the psychiatric nurse in your district. You need to take them over to Port and the different places that. So we act as the referral agents for the Ministry of Health in terms of psychiatry.
And it's also helpful that when people who are on the streets go to the resource center, that you can get an opportunity to keep them on treatment as well. So you can tell when someone comes in and they haven't had their medication, or...
And we make checks. We would call and find out when last Mr. X has his medication, and they say, you know that we are looking for him, and we'll say, you know what, he or she is here at the center. And then we call, they're leaving now. So they know how to get them, and we see the direction they're going. We are not a medical facility, so we don't so much encourage medication taking at the center.
Okay, but you refer with
we
the
refer. We
Ministry of
have
Health.
rare cases that we accept that they do, one or two, the people who accept that, you know what, you could find me at the center, and they no problem with compliance for medication.
Or do we see are we seeing a rise in mental health cases?
Coming to the center, well, to date we have 492 registered. Of that 492, we only have like 38 females. All the others are males. They're registered, but they're not at the center every day. We do have our regular, but we on a event basis, someone could call and ask about Mr. X. We could go in our system and say, you know what, he had visited the center, and we could check our logbook and see when last he did, and things like that.
I just want to add to that. We also have a mobile clinic, but it's for our patients. That means we already know who you are, we know your diagnosis, and we know your treatment. So we'd go out and take it to you. So it's not for new undiagnosed patients then.
You can't just go up
So
to
you
the
just
mobile
can't-
clinic.
Yeah,
or-
you just can't call us
Just-
up and say, oh, so-and-so in our neighborhood is acting straight, could you please come? No, that's not the service we would offer.
They have to be diagnosed.
They have to be evaluated and diagnosed
That's
first.
the first thing I would ask when they call.
Yeah.
Is the person diagnosed? Has he or she been assessed? And they would say no. I said, well, then you need to take them over, and then the process start from there.
Wow.
So this year's theme, looking at young people. Talk to us about where the mental health unit, there's also the Mental Health Association, there's the work being done at the Resource Center. How are we getting the message out to young people that mental health is important, good mental health is important, and that we are still paying attention to possible areas where people may need to get help if they need to?
We continue doing promotion as often as we get the opportunity. But this is the month, between September and October, because September we have World Suicide Prevention Day. So there's a lot of promotion in September along with celebrations. And then we have October. So this is our 2 months where we do push a lot of information out there. So there's articles going out in newspaper, there's, you know, these type of shows we're on, and we do visit different places, and it happens all over the country. So we have a team in every district that is working.
How we get to young people, for example, we have like Nurse Bennett, she is a lecturer at the different junior colleges, and then she would tell them that you need community service. volunteer at the the resource center. So they'll come and then they'll see and get the feeling of being there. Also, service day. We have schools coming in on service day. And so they come and they interact with our participants.
What's it like for the young people when they go there?
Excitement. I mean, usually they would see an individual on the street and shun him or her, but when they're there, it's different. I mean, they'll do their nails, do their hair, and they look forward to see them on the street, and now they won't refer to that individual or that crazy one. They could call them by name.
Names. You
Yeah.
actually
And
see them calling them by
calling
names.
them by
That's great.
names, and a lot of respect for the most part. When students come, sometimes they do meet their parents there, and then they end up sharing, and then it's I mean it's a wonderful feeling when you go to the center.
But that's a great way to start to cut down on some of the stigma. Because I know growing up, kids used to be really cruel to some of the people you'd see on the streets.
Right.
But they are a mother, a father, a sister, a brother, and many times struggling with mental illness.
But for me, it all stems from how us, the adults, actually treat these people when we see them out there.
Yeah.
And so the child will naturally want to follow that. So to know that, of course, not an open house policy whereby you could go on in there and meet or to learn. I would strongly suggest that people go on there and try to see how they can help. Because honestly, it's an eye-opening situation for me, and it gives me now a new respect for when these people come up to you and ask you for something. So I think this is one of the ways we could help. You did mention, however, that the fundraising aspects of things. Today is actually World Mental Health Day, and there are activities planned out for this particular day, actually for the weekend. So let's jump on into that. What do we have planned?
We have planned today, we have an opening ceremony, and this is in collaboration with the Ministry of Health, the Resource Center, and the Mental Health Association.
And one more. This year we also collaborated with the youth department, being that it is with young people.
Nice.
Yes.
Yeah.
So we will be having a speech competition. It starts at 1 at the Bliss Center for the Performing Arts.
Yeah.
7 schools participating. We have Bishop Martin all the way from Orange Walk coming. So that's this afternoon at 1.
What's the speech? What are they going to do a speech on?
Yes.
Yeah.
The speech will be on mental health in a changing world in relation to bullying, in relation to digital addiction, community stress, and
Violence.
the list goes on. Violence, stress, and the list goes on.
And you've been doing this for a while, the speech
The speech
competition.
competition.
This
Yes.
is it here.
And so it forces young people to do research on mental health and different issues and then present it to other young people.
Present it.
That's cool. That's one way to get at them.
Yeah.
So how surprised are you by what they present on stage?
Oh, it's very impressive.
Yeah.
They do really good research, and their presentation is amazing. How good they are at delivering a speech without, reading from note cards or anything. It's so amazing at that level that they are. They can do that.
So that takes place today.
That's
Yes.
it.
Is it open to the public?
It's open to the general public. It's a free event. Come out
Okay.
and listen to our young people, hear their views, and see how best we could assist them.
Okay.
There's also forums going on in the other parts of the country. I have to big up the other teams as well. In Orange Rock, there's a youth forum, and there's also one in Balmopan going on
Okay.
today.
Focusing on mental health as well.
Right.
And so that's what's happening in Belize City. And then what happens this weekend?
This weekend, Saturday the 13th,
This is such an interesting idea. And
Very much.
we're having a night of being homeless, sleep it out. It starts at 6, from 6 to 6. We're asking people to register. Like I said to Jan, this is the only time you're legal to sleep out. So we're asking the general public to support us.
how are you home? How do you do homeless for one
Yeah,
night? What do you do? Just
Well,
tell us what's expected.
Please.
what is expected that first you register with us at the center where you buy your t-shirt, and that's your registration. It's $25. You get a box. If you don't have your box, we will provide a box.
box.
A box.
Remember, it's homelessness.
It's homelessness. And you might not even get an entire box. You might just get a piece of a box. But enough for you to lie on, right? For the people who could bring your own bags,
No problem.
you could do that. We have some people asking about bags that
Sleeping bags.
sleeping
bags,
bags. I'm still considering charge a little extra fee because
Yeah.
you shouldn't be too
Get to
comfortable.
cozy,
Yeah.
It's not
So, but,
camping. It's not camping.
Also for the students, we're offering community hours. You buy your shirt, you get your community hours for being with us for that time.
That's lovely.
No one has to be out there the entire time.
Yeah.
Yeah.
So
Just a few
come
hours.
and give us a few hours and it's much appreciated. But we will have a short ceremony like starting at like 6:30 just to raise awareness. What is it about? What we do at the center? And even a few testimonials from our participants. People are asking why not do it at downtown Battlefield Park? We can't do it there because we will displace our participants because that's where they sleep.
Yeah.
So we don't want to get into their spaces, so we'll have to find our own space. So we'll use the Memorial Park.
Memorial Park.
Where did this? I mean,
The
what do
idea,
you
yes.
want people to walk away with? If I voluntarily choose to give up my bed for one night, and I go out and I sleep on cardboard at Memorial Park, what do you want me to walk away with?
I want you to walk away with one, empathy, and two, the idea that, you know what, security, bathroom issues, those are the first thing that came to our mind.
Yeah.
But what about security? What about how we use bathrooms and things like that? These are things that readily come to our mind that, you know what, we need, but the population that I serve don't have access to these things.
Yeah.
And so for them, that's like secondary. But for us, that's the first thing we're thinking about. The bathroom and our safety. I mean, come on, these people are out there 365 days of the year. And they don't have this, not to say they don't worry about it, but what can they do? It's not there.
Yeah.
But we'll have that there. So, I mean, we're not pretending to be homeless. It's just to raise awareness of the plight of the population that we serve.
And because your center doesn't allow for, it's not an overnight facility.
No, it's a drop-in.
Yeah, so that whoever goes to the resource center would still be sleeping in a park or another area.
And how many
During the
people
course of the
registered so far?
For the sleep out, we have 79.
What?
Only 79.
Only
The park can hold more.
The park.
walk at Dangriga and PG.
Okay.
All right.
So we're covering most areas.
Oh, definitely.
So if you're struggling, know that you can get help. It's not a matter of cost. It's just being able to take the step and reaching out.
Yeah.
Thank you for being here. We're going to go ahead and take a break. When we come back, we'll be talking about the Global Leadership Summit when we come back.